first abstract presented by Professor Schmid targeted triple-negative breast cancer, which is a breast cancer once it's metastatic with a dismal prognosis. And we have a lot of patients out there right now in clinical trials with immune therapy, but so far in breast cancer, we have not seen the tremendous effects that we've seen in melanoma or lung cancer. So this is the first time we have a phase 3 trial proving that immune therapy in triple-negative breast cancer improves survival. And I think this is something that will change the way we practice in triple-negative breast cancer. The other two studies, they targeted hormone receptor positive, HER2-negative breast cancer, even though Professor Andre said with a poor prognosis, it's much better than the triple-negative breast cancers, but we haven't seen much progress there. We've seen the CDK4/6 inhibitors, and there's 3 compounds from 3 different companies, and they all prolong progression-free survival, but there's still a lot of uncertainty out there in the community whether to give these drugs, when to give these drugs, and also from the payer's perspective, because there's no overall survival. So I think this is now going to change. 10 months overall survival benefit in a CDK4/6 inhibitor study in the second-line setting, I think is unprecedented, and I think will change people's hearts who weren't quite sure, and I think we can now confidently say to our patients that this is the drug to take, in my personal opinion, also in the first-line setting. And please keep in mind, for this particular presentation, I'm a bit biased because I'm a co-author. So, but and Fabrice's talk, I think, and Giuseppe said this very nicely, is going to lead us into the area of precision medicine. Also here, we've had numerous talks, also phase 3 trials with the PI3 kinase inhibitor, where we saw marginal benefit, and the drugs weren't usable in clinical practice because the tolerability was so bad. So this is now the first phase 3 data proving that if you have a targeted drug and you have the tumor has the target, you can actually almost double progression-free survival. And I think this will also change the way we practice in hormone receptor positive breast cancer, because we now have to define the targets and then treat accordingly. And all of these abstracts, I think, are extraordinary, and I think we'll be very privileged to hear them this afternoon at 4 o'clock. Thank you very much.